Hello, everybody. It's really nice to join you today. Can everyone hear me all right? Great, great. Since we're a small group, I just want to start with some logisticals. I'm going to be jumping around a little bit on documents, but feel free to use the chat room. Mike will let me know if we have questions that are pertinent to something I'm speaking about. I'm happy to be interrupted. Since we're a small personal group, it's easy to do that. So you can also raise your hand while I'm speaking, and then I know, it's something that you'd like to ask right away. If it can be saved, we're going to have a question and answer period at the end as well, because I think you all have very good questions, and that's how I find out what you're thinking about. But today I'm going to talk a little bit about COVID-19. My name, first of all, is Dee. My full name is Deanna, but I go by Dee, Dee Myrvang, and I work for the Department of Health, which we call VDH, Vermont Department of Health. We love acronyms, so I will apologize before I start. I will use some acronyms, but I will try to spell them out, and feel free to ask me if I don't. I have worked with the state of Vermont Department of Health now for 3 years. It's kind of another new career change for me. I'm in my 50s, and I tell my grown children to not get too wrapped up in what they do, because they may change careers 6 times in their lifetime, which is kind of a new thing, I think, in our society. But I thoroughly enjoy working here. A real quick personal background, I actually grew up in Vermont, in Woodstock, Vermont. My dad worked for Lawrence Rockefeller. He worked at the Woodstock Inn. And I was blessed as a child because my dad worked for Lawrence for 15 years, and I was born in Puerto Rico. I grew up in Vermont and Pennsylvania, and then ended up in California. But I left at 10 from Vermont, and I would have dreams that I had moved back to Vermont as a child. And it took me 40 years, but here I am. So I feel blessed to be back in this beautiful state. I was able to bring my husband and our youngest son, who is 15 at the moment, and we live in Manchester, and we really love being here. So I work for the Department of Health in a unique position. My position is called Emergency Preparedness Specialist. And people ask me, what do you do? And I used to say I plan for pandemics just to see what kind of response I would get. And mostly people would look at me very confused and not know what that meant. Now people know what that means. But I have been blessed working here in the state of Vermont on this response for the last 8 months. I was a part-time employee. I've been full-time since the pandemic. And it's really nice to feel like I have a job where I can work on the problem and feel like the work I'm doing is important. So thank you for joining us today. And I hope everything that John and I have to say makes sense and helps you understand a little more how we're responding to the pandemic, not just from an employee perspective, but also volunteer perspective here in Vermont. So my outline for today is I'm going to talk a little bit about COVID first and what our numbers are looking like and some of the things the governor's been saying. And then I'm going to jump into our Medical Reserve Corps, which we call the MRC, and talk about how that's part of my work, but also what we do in Bennington County, who we are, and how we're helping in this response. And so to start, I like to start with numbers. I'm very focused on numbers, more so than I should be sometimes. But I'm going to share my screen, and I'm going to show you the numbers that came out on Wednesday, which some of you have probably seen, and then just talk a little bit about what's going on in the state. So let me try this. Just give me 1 second here. Okay, can we see the case information numbers? All right, of course they have to be in red. Let me make this bigger. So this is a graph that is up almost every day on Vermont Health response. If you have not spent any time on the internet looking up Vermont Health response, I'd be surprised, but that is what I send everybody to for information. Of course, world information, I go to CDC in the country, but for the state, I go to our Health Vermont COVID. If you put in only 3 words in your search bar, Health Vermont COVID, you will get the state Vermont page on this. And this is one of the graphs they put out daily. It gives you a lot of information. So to briefly go through it, as of 12 p.m. on the 25th, which was Wednesday, we had 81 new positive cases that came in the 24 hours preceding Wednesday, to give us a total of 3,827. The main thing to keep in mind, as I'm sure you all know, is our numbers have been going up over the last 10 days. We're averaging closer to about 100 cases a day, and we really want to see those numbers start to drop soon. Why? I'll talk about the why in a little bit. Currently hospitalized is a really important number. That's, you know, the way I look at that number is that's 2 to 4 weeks behind the positive case surge. So if you think we've had a surge in the last week, the hospital numbers really aren't going to surge now for another week or 2. And what we watch is the currently hospitalized and the ICU numbers. So there's 2 things I tell people about COVID that we're trying to control in Vermont. Vermont is unique. I won't go on and on about how great we are, but I will say we've been blessed in that our COVID numbers have been much lower than most states in the country. We have kept our positivity rate under 2%, which I think there might be one other state in Hawaii that's done that across the board since March. Why? Lots of whys. I think after we get through this, we'll all look back and learn. But I thank Vermonters. I thank the fact that we're in a rural state and that we like to social distance anyway, and that we spend a lot of time outside. And our circles are smaller than people who live in big cities. So we just come across fewer people. But we also have been very careful since March. We have seen more mask wearing in the state. We've seen people being careful of their circles. We've seen people not shopping all the time, but maybe going once a week. You know, some of these things that over time get very tiring for all of us and we get fatigued, they really do work. So what we look at is if we can keep our positivity rate, so that's down under hospitalized, under investigation. We are currently, as of Wednesday, at 1.4. Earlier in the week, we went up to 2.1. So we were climbing, and right now we're kind of hovering between 1 and 2%. Keep an eye on that number in the next week or 2. That will be really important to see what's happening after Thanksgiving, to see if our numbers start going up again. But there's 2 things we're really trying to do in Vermont. We're trying to keep our schools, those that can, open. If not partially open here and there, hybrid. There's all kinds of models. Every school union and district has had the ability to have say in how they have school. And I know the Bennington School District's been a little different than our district up here, but we're really trying to keep our numbers down so kids can go to school and so teachers can keep teaching. And then I'm sure you've seen across the country that really varies from state to state. The other thing we really watch in Vermont is our hospital beds. And I know every state is doing this, but I like to throw out 2 numbers. They're easy to remember. How many hospital beds do we have in Vermont? Does anyone want to throw a number out there that are available at any time? Capacity is what I'm looking for. Any guesses? You're all on mute, so I'll keep talking. We have about 800 hospital beds in the whole state of Vermont. Most of them are in the UVM system, but we have about 800 beds. If one hospital fills up, they have the ability to transport to another hospital. But the key number, how many ICU beds do we have? That's a much smaller number, and it's a much harder number to surge because of all the equipment and staffing that comes with ICU. In Vermont, get ready, we have about 200. ICU beds, okay? 200 for 630,000 people. So that number is what drives a lot of what I do, because we want to continue to have ICU capacity throughout the pandemic. So the sickest people in Vermont can get into an ICU bed if they need one. And it might not just be a COVID person, it could be someone having a heart attack or somebody with a much more serious condition. So what I really watch, and I encourage everyone else to, is that percent positivity and hospitalized in ICU. We can keep that hospitalized under 200, we're doing something right. The other thing worth mentioning is we can surge in Vermont, meaning we can create more hospital beds. And you may remember in the spring we did that. And actually right now we're starting to reopen some of those facilities. These are places like the Spartan Center, where you have a very large, maybe auditorium, and we bring the National Guard in and they basically create walls and beds, cots. These are not your typical hospital rooms. You're literally in a large space with a lot of other people. So we send the least sick people to what we call surge facilities, if and when we need those. So I just wanted to throw that all out there because not everybody knows how our hospitals plan for these things, and they are in what's called Emergency Operation Command. And as numbers go up, they start planning for surge potential. So the good thing is we had a lot of practice in the spring, and now our hospitals are ready to mobilize at an instant's notice so that we can increase our beds as we need to. People tested, have any of you been tested? Raise your hand. So many Vermonters have been tested, if not once, more than once. And people tested is the number of people who have received tests. So if you receive 5 tests, you'd be shown in that number once. Total tests is the number of, I'm sorry, I just said that the wrong way. The total number of people is 218. The total number of tests means a lot of those people have been tested more than once. And the death rate, you know, we don't like to see any deaths from COVID. We were very blessed for many months. We didn't have any deaths. And now we're starting to see some. Most of these deaths are folks in congregate living settings who are older and often have comorbidities as well. But we really have been working hard to protect our most vulnerable in Vermont. And the governor just announced today we'll be doing another round of testing in all our congregate living facilities. And that is one way where we try to keep those cases low, but also find when there's a positive. And oftentimes they come in from staff. So we're getting better at testing all the time, but any questions on these numbers before I move on? Okay. Let's see. I'm going to go to my other sheet. Excuse the jumping around here. Okay. There we go. All right. So I just want to say thank you to all of you for putting up with us. I know it's been a very long 8 months, and I think we all know it's going to be a long little winter for a while. I will talk at the end of this about the vaccines that are starting to roll out and the pre-vaccination planning that we're doing, which gives us all a little hope to look forward to. But before I get into that, I want to start by talking about our Medical Reserve Corps, as that's really why we were asked to speak today. And the Medical Reserve Corps is not unique to Vermont. We have Medical Reserve Corps all over the country. The MRC program was actually started after 9/11. We learned from various disasters around the world, like the Bhopal disaster, as well as 9/11 as a good example that people want to help in times of emergency. But people don't always know how to best help. In 9/11, you may remember hundreds of thousands of people with clinical backgrounds, first responder backgrounds were showing up, just showing up to help on site. In many ways, that was helpful. In many ways, it wasn't helpful because some of the folks that were helping probably should not have been there, have had health issues ever since, or maybe weren't the best volunteers to have on site. So what we learned is it's better to have a medical reserve corps, which is also a civilian corps. So people think because of the word medical, you have to be a trained clinician to be a member. That is not true. Anybody with any skill set can be a help to the Medical Reserve Corps. But the Medical Reserve Corps was started with the idea that we want people who have medical training and people who have first responder training to be signed up, verified, background checked, and approved before the disaster. Great idea. Because we all get very busy when disasters hit and we don't have time to do those things. So in Vermont, we have been building our Medical Reserve Corps since 2003. And actually, the MRC of Southwest Vermont, our unit, one of 10 units, was the first unit developed in Vermont. We currently have 62 members in the Bennington County or MRC of Southwest Vermont unit. Out of about 781, that number is continuing to grow. We have had a huge influx of more members since COVID-19 hit. That's pretty normal. When the disaster hits, people want to help. So one of the things I've been doing since March is just going out and talking about our Medical Reserve Corps and helping people understand who we are, what we are, and why we ask people to sign up. And a lot of our members don't do anything for a couple years, and then an emergency hits and they're on the front lines helping us. So who are these people? Who makes up the Corps? I really like to show another visual, which will just take me a second, because I think it gives us a really good sense of who are these folks. And I'd have to find it. Okay, let's see. Give me one more second here. There we go. So the people that make up the Corps, as I said earlier, are not all medically trained individuals. We do ask for nurses and doctors and folks who have clinical backgrounds to sign up if possible. I'm going to make this large. Can you all see this now? Okay. So this gives you a sense. This was in April. This was a count of who was in our Medical Reserve Corps at the time. And let me see if I can scroll down. So what you see is most of the people who register with us are nurses and doctors. But then I really like this because it gives you a sense. We have a lot of clinically trained people, whether it's LNAs or licensed clinical mental health counselors are very important in times of emergency. We have EMTs, we have social workers, we have PAs. All of those are fabulous, but if we keep going down, we have fewer and fewer of folks like teachers. John Gagnon, my coordinator, is a retired teacher, veterinarians, dentists, military, firefighters. We really need a little bit of everything because, as I'll talk later, when we're activated, the Medical Reserve Corps, we're often helping with things like vaccinations. And yes, there are people that give the shots, but everybody else helping to run the vaccination clinic, most of those folks don't have clinical backgrounds. So I really like to give this as an example to show folks that the Medical Reserve Corps is made up of you and me and everybody in between. And the more folks we get signed up in Vermont over the long term, the better. Okay, now I have to go back to here. There we go. Can you see the screen again? Okay. What do we do and who do we partner with? So the folks who make up the Corps are really a variety of people that live in Bennington County. As I mentioned, 62 folks in Bennington County. Out of that list, I think I have 3 physicians and about 10 nurses. the key is that these folks have been signed up, they filled out some background paperwork, they got approved, and now they're in my roster. And anytime the state needs something, they can send out an activation to all 781 people or just to specific people within a region or within a geographic area. So for example, I'm going to show you what it might look like if somebody were activated. Let me see. So can you see my email screen, or is still the same? Yeah, let me try this again one more time. Okay, so this is an email. Can you see an email? Okay.
Yes.
So basically, once you're a member of the Medical Reserve Corps, you're doing your life, you're working. A lot of our folks work full time, a lot of them work part time, and then they get an email from us, and it says something like this. So this is one of the more recent emails that went out to our membership. It was asking if they would like to help with a long-term care facility that is struggling with staffing right now. So, and it's very specific what they're looking for. They're looking for an RN or an LPN. What happens once you become a member of the Medical Reserve Corps is the state can say, okay, we have a need for X. Is that something that would be appropriate for our Medical Reserve Corps volunteers? If it is, they'll send out an email like this, and you would get an email like this, and you would scroll through it as a member, and you would see that, okay, it's in Burlington. This is who I contact. I let them know, no, I'm not available, or yes, I am available. The beauty is that because there are so many of us in the state, we'll get different requests for different areas of need, but we won't feel like we have to respond to everything. I don't generally respond to anything that isn't within an hour's drive for myself, because I don't want to waste my time and everybody else's time if I don't have to. The nice thing is we can help in many different ways. So MRC members have helped since COVID-19 respond to everything from helping to give out food at our food distribution sites, helping to staff at hospitals. SBMC activated about 20 of our members in the spring to help with scheduling and screening of all their staff as they would enter the buildings. So they see us as an additional staffing resource as needed. So if a hospital is experiencing staffing shortages, which is starting to happen all over the state right now, they can look at this as a resource for them to draw new staff from. Now, often they will ask for a volunteer to serve in a capacity on a short-term basis, but we have had some of our volunteers being asked to step up and be paid for the position a little bit longer term. So that's also an option for some people. Most of my members aren't looking for work. They're really just looking for a way to help. And the nice thing is whenever an activation comes through, it's very specific for what the work is and for how long the person is needed. So the MRC can help with everything from testing for COVID to getting food to people who need food, to staffing at our hospitals and long-term care facilities, to helping with vaccine distribution. So right now we are starting to gear up for COVID vaccine, which is very exciting. I think we're all very happy to hear that some vaccines are coming down the pike. When you think about vaccinating, say, 70% of the American population, it's never, ever been done before, especially in a way we're going to be doing it, where we want to make the vaccine available, but we have to do it by priority groups. And then we have to make it easily accessible. And then we have to track everybody who gets the vaccine, because they're going to have a second shot, and they have to come back for their second shot. So there's a lot of people power that will go into these vaccine clinics. And this is where the MRC will really shine, because we will have the people necessary to open these points of distribution very quickly and help people get in and out quickly and answer everybody's questions, as people will have many questions. So having a conservation corps, some people know it better as that, a medical conservation corps in this country is really going to help us, has helped us during this pandemic tremendously, but will continue to help us during the vaccine phase and hopefully into the future. With any emergency we have in Vermont, it could be weather related, it could be internet related, an IT issue. For example, University of Vermont 3 weeks ago was cybersecurity hacked. That's the best way I can put it. Their systems were hacked. This was happening all over the country, and they went down. Their systems were down for almost 3 weeks. They were still able to perform their duties and operate, but it was a huge hit to our system. We were able to put some National Guard folks in, and UVM has been working nonstop to get back up. They are currently in the process of standing up all their IT systems once again, but it did take 3 weeks. That's a great example where a volunteer corps of IT folks can come in and actually be a huge help in a short period of time. Okay, who do we partner with? So that is the best, one of the best parts of my job is when we're not in an emergency mode, I get to spend time building relationships with organizations, individuals, and groups that really fit with what we're doing. So first responders, I've been working hard with the police departments in Bennington County, the firefighters in Bennington County, our local emergency planning commissions. You know, the beauty in Vermont is we're small enough. There are about 38,000 people in Bennington County that we serve. And I get to know everybody on a first name basis. I know my town managers. I'm still getting to know my fire chiefs, my EMT folks, but also organizationally, who do we partner with? We partner with the Free Clinic or BCCH, Bennington County Coalition for the Homeless. We partner with GBICS, Greater Bennington Interfaith Community, I believe. We really look at how can we be most effective, and usually by partnering with some key organizations. Rotary would be another one. Is there a good fit for us working with Rotary on maybe a service project in the future? We look to partner with anyone who would like to partner with us. So this could be a health fair. We partner with the hospital quite a bit. When they do a health fair, we'll send in some people to staff the health fair or to provide more information on who and what we are. We've been wanting to have a table and a booth at the Bennington Garlic Festival. And we were going to have a cooling booth this year where you could get misted and learn all about MRC. So we're always looking for ways to just get out into the community, let folks know who we are and what we do, but also to provide services. We do trainings. So what kind of trainings do we do? So as I mentioned, we look for folks who want to join us. Many of them already have clinical backgrounds, but we do ask all our new members to take the basic trainings so that if they were activated tomorrow, they would know things like personal preparedness. Do you have yourself prepared in times of an emergency so you could leave and go work at a shelter for a few days? We talk about things like taking care of how to distribute medications effectively. We teach on pods, points of distribution, which we'll be using in the vaccine efforts. What is a pod and how do we use them in Vermont? We also do individual trainings like CPR and first aid. We kind of look at what does our membership in our unit need, or what do they already have, and how could we augment or support them more. One area that there was a lot of interest was personal protective measures. A couple of years ago, we're talking a lot about active shooter incidents, still do to this day in the country. And so we were doing active shooter trainings. What would you do in the time of an active shooter? How could you be the helper? We really can train on almost anything, but the beauty is once you're a member of the Medical Reserve Corps, there is a training site and you can find a training on almost anything, psychological first aid to how to do contact tracing in times of COVID. And all of those trainings are free to our members. So training is a big perk for why a lot of people become members, because all these trainings are free and they're constantly being updated. Okay, one last little piece of info for the day. So we talked a little bit about what would we be activating our members for. So we are now starting pre-vaccination planning. As I'm sure you've read in the news, there's a lot of logistics involved in the COVID vaccines coming down the pipe. Some of them have to be stored at incredibly cold temperatures. Some of them have to be given within an hour of being taken out of a box. You know, we're hoping these things will get a little easier. But the beauty is, because we've been planning for a disaster for a while, we have what are called pods. And pods can mean lots of different things, but in this context, they are points of distribution. And we have, as John mentioned, public pods or open pods and closed pods. Closed pods are private organizations or businesses who apply to become a pod. And the idea is they have a medical person on staff and would be able to distribute medication or a vaccine to their population. For example, a couple of my closed pods in Bennington County are the hospital is a closed pod, meaning they can receive vaccines and distribute to their population. We also have Bennington Rescue is a closed pod. The Veterans Home is a closed pod. The town of Bennington is a closed pod. Town of Manchester. Our biggest businesses like Orvis is applying to be a closed pod. MAC. You know, we're basically trying to take some of the pressure off a public pod. So what is a pod? If you look at this and I make it a little bit bigger, let's see if I can, there we go. So the mission of a pod is to quickly and accurately distribute medication or administer vaccines. The idea with a pod has always been, if you activate a pod, you should be able to administer to your full population in your district or county within 48 hours. It's a little harder with a shot, and we're not actually going to roll out this vaccine that fast, but a pod is a location that already has a legal agreement in place, and we could actually stand up and use within 4 hours of notifying them. Pods are used for worst case scenarios, meaning if the hospital and the pharmacies can't vaccinate everyone, then we will be using pods. So in Vermont, we are going to be looking at opening an open pod in each district. The first vaccines that will be coming out sometime in December will be going to the first phase. And the first phase will be our frontline healthcare workers in Vermont. And so the hospitals will be doing what we call phase 1A, and they will be vaccinating their frontline workers. Those will be the first people to receive a COVID vaccine. After that, it very quickly goes to what we call our vulnerable populations. So in Vermont, we're looking at folks who are over 65 and have what we call comorbidities or other healthcare issues that might make them more susceptible to getting COVID and not doing so well. So the pod is a wonderful option because we can send the vaccines directly to our closed pod hospitals to do that. They administer them, they track everything. And then we, the Department of Health, can be focusing on opening our public pods and starting to prioritize who are the folks coming through the pod and how are we letting them know that it's their turn. This picture gives you a sense of where our pods are located. You can see we've spent many years setting up this system. So we not only have a pod in every district health office, but we have pods at college campuses. In Bennington County, for example, we have pods, whoops, sorry, I went a little too fast there. We have pods in Manchester at BBA Academy, the high school. We also have a pod at Northshire Civic Center or Riley Rink. And then in Bennington proper, Bennington College has been one of our more responsive pods. They have been fantastic through this whole pandemic, giving us their location whenever we need it. And we also have Southern Vermont College, as you all know, is going through a bit of a transition right now. My hope is, as looks like the hospital may be acquiring it, that we'll be able to continue using that location as a pod as well. A pod has to be a very open space that's inside, like a gym. And if you think of Bennington College gym or Greenwall Auditorium, they call it, that's one of our pods. A pod has to have a really good flow, meaning people can come in one door and exit a different door, and it has to have a lot of space to accommodate the numbers of people, the airflow, and all the things that we have to take into consideration. The staff for the MRC are the folks who actually work the pod. The head of household model is more focused if we were giving out pills, but in a vaccine shot distribution, people would have to come individually to get their vaccine. We can't send shots home with mom and dad to give to the kids. Let's see, I don't want to spend too much time because I know we're getting close here. I did want to show you the flow of a pod just because it's kind of interesting. So people would have to go through what we call triage. That's often outside of the pod. Triage is to make sure that somebody who might have COVID doesn't walk into the pod. We're going to have police and security folks. We're going to have mental health workers on site. But basically, if someone shows up with any symptoms or any potential symptoms, they won't be allowed in the site. We have to protect the people that are in the site to our best of our ability. Once they're allowed in, they go through intake, registration, and basically they're sent to what we call our medical professionals to get their vaccine. And then they're sent home with paperwork and directions for when to come back for their next shot. So pods are a really nice way to safely and effectively immunize a population. Thank you, everyone. Enjoy your weekend and stay safe and stay healthy.